This was probably 4 or 5 years ago now that I asked our administration if I could start looking into the organization having a way to help treat people with opioid use disorder. Prior to that, I had some experience with that just in my residency, but my first several years here, we didn't really have anybody who was able to offer that kind of a service. So patients that I had that would need that care needed to travel, and it's 70 miles to the closest place. We're an organization that really listens to what our community is telling us, and I said, you know, this is what our community needs.
We've always looked at opportunities that we could do here locally so that patients didn't have to drive so far to be able to get the care that they need. When you're in a rural area, it's harder to get to things. It's harder to have availability and access to things. So our commitment as physicians was really that idea of we're going to put that patient first. We're going to take care of our community.
So I think if people just feel comfortable and we're being more open and they feel like they can walk up to any of us and approach us, I think that's the step that will start changing the decisions the human factor has in the end. And just meet them where they're at and talk to them like human beings.
I actually got a call from one of my patients on a Friday afternoon at around 4, and he was in complete crisis and distress and admitted to me on the phone that he was using opioids and that it was, you know, ruining his life. And I just felt helpless. I talked to him for a long time, but there wasn't a lot I could do to really help him at that moment. And that was kind of my last straw. So I went to our administration. It's not necessarily really financially beneficial or fruitful to be doing this type of treatment, but it's what our community needs. So they gave me the resources I needed to get a program started. One of the biggest hurdles that we had in implementing our program for opioid use disorder was the documentation piece. The old way of documenting that we had was very cumbersome. Now in MEDITECH, I have a note built, and every time I see patients once a month for this, so every time they come in, their notes take me 2 minutes or less to do, and I can just spend more time talking with them. You know, I have a patient who at one point was barely making, you know, she was spending so much money on the opioids every month. Now she's bought a house, and you know, so I mean, it's just a wonderful thing to see.